that was formed. So let's get on with it. So, as I mentioned, I published a book entitled Institute of Agricultural Medicine, an Iowa idea with worldwide impact, with my with Dr. Bill McCulloch, who was one of the early founders of the Institute of Agricultural Medicine and one of my primary mentors. He is one of the few that still survives. He lives out in Beaver, Oregon. He ended up being the dean of veterinary medicine out there. But again, one of my major colleagues. And so you can get this book. It's a ebook, which makes it nice in terms it's got a lot of documents and things in there of material that I found and put together over the years without really cluttering up the content of the book overall. So what I'm taking is just some snippets from that. You can also find out some additional information on that book by clicking on this link here, which Dan McMillan put on our College of Medicine website, talks a little bit about the book and so on. I want to mention the reviewers and participants in this book, and that's Bob Wallace, Jim Merchant, Keith Long, Holly Carver, and Gene Dunham, who was kind of the overall technical editor for the thing. So anyway, I commend that to you to look in more detail. So how did this writing of this history begin anyway? Well, it really began back in 1999. And I had what we called a founders reunion. And these were the principal people who really, at the beginning, were responsible for putting this thing together. I'm not one of the founders, that's me and my wife, Jean, but these are all of my mentors here. Keith Long was one of the founders with his wife, Hazel. Pete Knapp with his wife, Jackie, was also, again, one of the founders. And then Bill McCulloch over here, one of my mentors and also one of the authors of this book. So why do we want to do this? Why the history? Why is that important for anything in the world anyway? Well, I want to go back to a couple of quotes here. And one is with this Marcus Garvey, and he was actually from Puerto Rico. And he was kind of I guess what I call a Renaissance man. He was a politician, he was a poet, he was an author, and just kind of a big thinker. And what he said was that a people without the knowledge of their past history, origin, and culture is like a tree without roots. And so I'm going to try to provide a few roots here as to our past history and the origin. And then, I was discussing with Pete Knapp here one day, again, one of my primary mentors. As a young professor, I would come up with these ideas about how we could prevent injuries and illnesses in agriculture. And I would say, Pete, I've got a great idea. We can do this, this, and this, and we can really save a lot of lives. And he would pause a minute and look at me and he said, well, we did that 10 years ago. And here's the result of that. So, don't reinvent the wheel, build on it. And only the history and the detailed history will help us come from reinventing the wheel. And that really is something I think we largely do too much of, whatever organization or science that we're in. And my, I guess, bottom line is why I put all of these years and efforts into this is to appreciate and respect those that came before us and what they gave us. And so that's really the bottom line that gave me the hours and times of pulling together all kinds of information over these many years and putting this thing together. So that's why. And I do appreciate and respect those that came before us, and really, as the old adage goes, that we really do stand on the shoulders of some giants. Well, I'm not the only one that tried to approach a little bit of history of this department, and that is Bob Wallace, who was one of the department heads over the history of the Department of Occupational and Environmental Health. And for those students, you have to realize here that It was a department originally in the College of Medicine, the Department of Occupational, Department of Preventive Medicine and Environmental Health. Actually, that department started back in 1985 as the Department of Hygiene in the College of Medicine. Sometime in and around 1950, it was renamed to be Preventive Medicine and Environmental Health. And that is kind of where the bulk of all of this history and information was put together. That ended up in our College of Public Health in 1999. I kind of put these building blocks to where we are and how we got there today to put this in perspective. So as mentioned, in 1985, there was a Department of Hygiene. Actually, I'm sorry, that's 1985, should be 1885. Sorry about that. And in 1950, then that department was changed to the Department of Preventive Medicine and Environmental Health. Now, in and during that time, this department was a pretty sleepy department. There was only like 5 people at most there. They did a little bit of teaching in the College of Medicine, hardly any research, and basically focused on teaching infectious diseases and based a little bit of environmental health like water quality and that sort of thing. But in 1955, there was the Institute of Agricultural Medicine that was founded. And that institute and the resources that put into that institute added, more than doubled the entire faculty that was in existence. But it added, resources in epidemiology, biostatistics, and occupational health. 3 of the 5 major departments that are required in colleges of public health. Then in the early 1980s, it became the department, PM&EH, became more of a modern type department with divisions in that department in terms of environmental health and biostat and epi. Again, 3 of the major components of a College of Public Health. And then in the late 1980s, the department assimilated the School of Health and Hospital Administration, and then also added a fledgling department division at that time in community and behavioral health. So now there are 5 areas of expertise, so to speak, and then that was able to allow this department to transition then into the College of Public Health in 1999. So that's the building blocks where we come from. So backing up a little bit, in 1885 to 94 was a small department focusing on infectious diseases, water quality, et cetera, but really there was no real epi, biostat, or occupational health, so to speak, until 1955. And in that time, the rural situation in Iowa, there are 195,000 farms. Now today, for example, there are only 90,000 farms today. And so the farms are fewer, but very much larger. So that's just a perspective. But also in Iowa back in 1955, there were 600,000 farmers and family members and workers, which accounted for about 22% of all Iowans. There were 109 fatalities annually at that time in agriculture as a result of occupational injuries or illnesses, which accounted for about 50% of all occupational fatalities. And in 1955, nationally, there were 22,700,000 people living on farms in the United States, and accounted then for 12,615 occupational fatalities annually. So that's a lot of trauma. So it was recognized then by the dean of the College of Medicine at that time about the seriousness of the occupational situation out in agriculture. Dean Norman Nelson, and you look on the end there and it says DRPH, Doctor of Public Health, one of the few deans I think this college ever had that in fact had a public health degree. And Nelson recognized the tragedy of injuries and illnesses in the farmer. He actually had a classmate in the College of Medicine at the University of Michigan named Matthew Kendi. And Matthew was associated with the Kellogg Foundation in terms of their public health and community outreach programs. And they met at the 1954 American Public Health Association. And of course, they met there because they were friends, but they started talking about the seriousness of, what's going on in agriculture with all the illnesses and injuries going on. We should do something about that. What is Iowa doing about that? Well, that little discussion led into a plan that was probably scratched out on the back of a napkin and ended up in about a page-and-a-half letter that came to the dean, that is Dean Nelson from Kellogg, and offering up to $1.1 million a year. This is in 2021 dollars now, for 3 years, to be able to put together this Institute of Agricultural Medicine. And with that came the offer from the state through our College of Medicine dean and so on, that there would be matching funds after 3 years to maintain that institute. So that resulted then in 1955 with the Institute of Agricultural Medicine. Now let me back up just a minute talk to you a little bit about the Kellogg Foundation, which began actually in 1866 with the Church of the Latter-day Saints. Whoops, I'm sorry, back up. With the Church of, I'm not Latter-day Saints, I'm sorry, Seventh-day Adventists. And they started a health and wellness spa in Battle Creek, Michigan. It was headed up by John Harvey Kellogg, who basically looked this as part of his religion, a religion of bionic living. Now, the Seventh-day Adventists, one of the things is that they're very focused on very healthful diets. And one of the things was that John Harvey, and particularly his brother, started developing plant-based diets that would fit in with this religion of biologic living. One of them, of course, was taking corn and rolling it out into thin flakes and baking it, and so-called developed cornflakes and Kellogg cornflakes. So that helped this whole Kellogg organization start to develop. It was developed into a medical school as well as this wellness spa, and had a very big imprint in Battle Creek, Michigan. Now, just a little bit of a side here, something that's you might be interested in sometime, and that is in 1994, there was a movie made called The Road to Wellness, which is all about John Harvey Kellogg and that Battle Creek spa. And the guy who played John Harvey Kellogg was none other than Sir Anthony Hopkins. He was trained as a Shakespearean actor, but was here playing and representing, if you will, this sort of a little quirky John Harvey Kellogg. So watch that movie. It's made a little bit with tongue in cheek, but it does give you a little idea of what this health spa and that religion of biologic living was all about. So Kellogg Foundation gave the money and the institute was started. And at the time, Dr. Franklin Topp had just come in 1953 as the department head for preventive medicine and environmental health. Dr. Topp was a pediatric infectious diseases physician. He came from the Ford Children's Hospital in Detroit, a very, very lovely man, and I knew him quite well. Also, again, kind of one of my mentors very early on. And this picture is of one of the early advisory board meetings that was put together. There was, as you can see, all these people were on the advisory committee for the Institute of Agricultural Medicine. This is the dean here, Dean Norman Nelson. This is I.A. Packer. Now, if you remember a person who used to be the dean of our College of Public Health, founder of the College of Public Health, was James Merchant, and that is the son of I.A. Merchant, who is the dean of the veterinary school at Iowa State University. And then we have Ralph Heron here in the background, who was at the Iowa Department of Public Health. And this is Durwood Baker, who was the associate dean of the College of Public Health at Iowa State. This is Bill McCulloch again, who is one of my principal mentors here on the faculty. And again, here's Clyde Berry. And that's all I can all I could recognize out of this picture.
Kelley, you don't know who the sole woman is there, do you?
I do not.
That'd be interesting to figure out who that is.
Yeah, yeah, that's interesting. Today you would see a little bit different gender balance, I think. But these are all of the people that I could recognize out of this. And by the way, one of the living founders at the time I was putting this all together was Keith Long. And he was 97 when he reviewed all of the things that I wrote. And he was really pretty sound at 97 years of age, but he could not recognize all of the people in this particular shot. So that was basically my attempt to try to get all the names, but that's the best I could do. So Dr. Top was, basically an urban person, from the city of Detroit, having practiced there as a pediatric physician, and got put into this situation. And he says, now we've got this institute and $1.1 million a year here to put this thing together, but I don't know anything about agriculture. And so he looked and found this person right here, who is Clyde Berry. Now, Clyde was an Illinois farm boy, and you can see a picture of him. This came out of his memoir. Clyde wrote 2 different memoirs, and this picture came out of one of those memoirs, practicing obviously safe practices on the farm. But he was hired to say that basically, here you go, Clyde, we got this money, you put it together. And so one of Clyde's early statements was that he says, my agricultural background was essential in developing the IAM. Otherwise, I would have no idea of the problems, the connections to rural doctors, specific injuries, the subculture of agriculturalists, and common injuries. So that's right. And he really was able to take that background and apply it to get this thing going. So here's Clyde standing, and to his left, again, is Bill McCulloch, who again was one of my mentors and one of the early founders in infectious diseases area. And this is Bill's brother, who I actually was in pre-medical sciences with his brother here back at the college or the University of Iowa back some years ago. He became a psychiatrist, by the way. So some other principal founders, again, I mentioned Pete Knapp here. Was an agricultural engineer, came from Ithaca, New York, where he was an extension agricultural engineer there. Brought with him a lot of experience of actually having direct contact with farms and how you try to prevent injuries by trying to engineer them out. Keith Long, I mentioned, was farm boy from Kansas, and who actually came here and was recruited here originally to the hygienic laboratory, and then the institute was able to convince him to come over to work for the department. He, by the way, Keith became a toxicologist actually, and he ran one of the 5 pesticide toxicology health effects thereof that was ongoing, sponsored by the EPA at that time. Very big program, a lot of early information on health effects of pesticides. And then William McCulloch, who I already mentioned, and I'll talk a little bit about him later. So these are some of the principal founders in the day. So how did I get involved? Well, I mentioned that one of my best friends was Kent Berry. That was Clyde's son. We were high school, junior high, and high school classmates, and so on. And that's how I got connected to that family. But again, growing up on our family farm, which is what's called the Peninsula area now, and it's owned by Iowa City, where there is a housing development. And to get there, probably the best direction for you to know where this is, if you know where the Iowa River Power restaurant is, there's a bridge that goes over the river right there, over the dam. You go across that bridge, and that's our farm, about 200 acres over in there. So we're hoeing weeds out of the corn here. That's me. That's my cousin, Jeff Wambacher. And that's my other cousin, Dan Potter. So I had that background. And in the spring of about 1960, I was working with my dad loading manure out of the barn in the spring, and an accident occurred where I actually ran over him with a fully loaded manure spreader and fractured his leg in multiple places, as you can see right here, both fibula and tibia. And it was a compound fracture. And so it penetrated the skin. He got osteomyelitis. He nearly lost that leg. He nearly died, but it was a touch and go thing there took a couple of years for him to really recover from that. And so I became the primary farmer on that farm while I was trying to go to high school. And also then during that time and few years after that, I had an aunt and a cousin who lost their life in farm accidents. I had 4 other cousins who were disabled either temporarily or permanently with farm injuries, all within Johnson County. And so actually, this problem was on my mind. And having that connection with Kent Berry, I was over at Clyde's house and with Kent for supper, and Clyde wanted to know what I was going to do with my life. And I said, well, I'm interested in biology and medical sciences and so on and so forth. And he says, come to my office on Sunday morning and let's talk. And I did, and left that with a research assistant. And so that really started this professional track of mine, and went on then through master's degree there, and they encouraged me that I should go on into veterinary medicine, because then I'd be able to understand more about the application of the principles of health and prevention in agriculture relative to more general human medicine. And so that's what I did. So that's how I got there from 1964 until I went into emeritus status in 2014. So that's quite a long history of that. And so again, just to kind of review, the founding faculty hired basically in this early phase between 55 and 60. I mentioned, and I color coded these a little bit because the green is kind of related to those that would be occupational environmental health oriented, and the yellow would relate to not only what we did, but also to what else is going on. So let me go through this. So Clyde Berry was not only a PhD in chemical engineering here at Iowa, but he was also developed his own industrial hygiene program, and became a CIH. And actually he really was the founder of the industrial hygiene program here at Iowa. And he was, of course, then sort of the person to put all the pieces together. Infectious diseases, Dr. Richard Chalma, John Brown, Bill McCulloch were all infectious diseases person doing good research in that area. And now we have the Center for Emerging Infectious Diseases here within epidemiology. Pete Knapp, an ag engineer, as I mentioned, again, kind of really relevant to occupational environmental health. Daryl Hagan and Paul Leverton were early biostat people in the department. Paul actually left after about maybe 5 or 6 years. He was actually one that taught me, was my biostat instructor, but he became the department head of biostatistics and epidemiology at the University of South Florida, and just retired not too long ago, by the way. Keith Long, I already mentioned, microbiology and toxicology, something that's relevant to occupational environmental health. We had anthropology was something early on, and now we have an anthropologist back with Brandy in the Iowa Center for Ag Safety and Health. And then Vic Beat was epidemiologist on the program. So you can see that very early on, there was some of these elements that really transitioned on into helping to strengthen and add all of these different resources into the Department of Occupational Environmental Health, which then made that department more eligible to become a new College of Public Health. So Now, let's talk a little bit about the facilities. Where was this work being done? So between 1955 and 68, the facilities were scattered all over the campus. There were parts of it going on in the medical laboratory buildings, which still stands here, one of the old parts of the College of Medicine. The UI water plant, which is down on Burlington Street, and at the Oakdale Hospital. And the Oakdale Hospital was really part of a 640-acre farm out, and also the tuberculosis sanitarium for the state at that time. So scattered all over the place in different activities. But between 1969 and 71, that changed because Pete Knapp worked with the Kellogg Foundation again, and they donated $9.4 million to fund a new building on the Oakdale campus. And as I mentioned, it was a large farm in conjunction, not only the hospital, but it was a large working farm. Here was one of the location of the dairy farm, which was one of the biggest and most productive dairy farms in the state. So that dairy farm came down, and up went the Institute of Agricultural Medicine building. So this picture shows it's the IREH, or the Institute for Rural Environmental Health. And so the name of Institute of Agricultural Medicine building was changed to the Institute for Rural Environmental Health in 1989. So there's that class. Now, here is something that's, certainly had a lot of foresight that Dr. Berry had, because as he was working with the administration, the university administration, on getting the place where this new building should be located, he had berms built out to the west of that building. If you've ever been out to the west side of that building, there's a bunch of berms out there. It looks like, basically ridges. And he convinced them to save that, because he said, we need this because we need to have a tractor test site, a tractor test track, which means that the idea would be you would take tractors and see how steep that you could run them on before they would turn over. Excuse me. But he had ulterior motives, because he also thought in the future that there would really be a nice opportunity to have a larger public health campus out there, a site for the hygienic laboratory and a site for the county public health department. And so he was able to save that site for that, and that then is where the University Hygienic Lab is located, just west of the old Institute of Agricultural Medicine building, which was helped to be saved by Clyde Berry's future speculation. The county health department did not get built out there as it was hoped to have been, but so since it was now the new Department of Public Health, county public health is built down on where the county administration building is. So, but yeah, at least that part of it was in his viewing. Excuse me, I'm picked up a cold or something from somewhere, so I'll be coughing a little bit here and there. So I want to cover a little bit of some of the early days and what research was done, and the roots that have found its way into what is existing now, or in the latter days of the department and in the early days of the College of Public Health. And so zoonotic infectious disease research was a really big thing. This is where I worked, by the way, and this is Bill McCulloch again. We did a lot of field work on a number of different zoonotic diseases, but principally leptospirosis, which is a bacterial infection. And we really described what the ecology of this whole disease was. We found that it was a disease of many different wildlife species as well as domestic species, and the organism lives in the kidneys of animals, and it's eliminated in their urine. So kids and people having exposure to water of all kinds, ponds or whatever, get the disease, or people working with those livestock species or working in processing plants. Animal processing plants are the main risk factors. So that's certainly a big picture. So some other things that went on early on, I should say, in this period right here. And one is that we had a veterinarian who showed up through occupational medicine and into our department for consultation, was a veterinarian who was having respiratory problems, asthmatic-like symptoms, sinusitis, just feeling terrible. Anyway, our research into it way back in 1974 indicated that his problems were all associated with the dusts that were being exposed inside these swine buildings. And principally, as we found later, was the component in it was primarily endotoxin, a component of the gram-negative bacteria that's in the air there. And that has led to studies still going on in this, in our college now, in the Department of Occupational Environmental Health, of this whole issue. So we were kind of the leaders in this area, the first ones that were ever able to publish the outcomes of some of the early research, and also has set up research now that's gone on in Western Europe, in Australia, and various other places around the world. We had a research team that was out in the field that was doing not only environmental sampling, but also doing assistance, wellness checks, and pulmonary function testing, and so on at farms all over the eastern and southern part of the states. And Alan Weinrich was a CIH, and Wayne Johnson was a physician working on that. Another one was working with a disease that is the most common disease of cattle, and that's lymphosarcoma, caused by a virus, known that can be transmitted between cattle and some other species. And so we also know that leukemia is a higher risk in farmers than in other populations. And principally, we found that it was at higher risk in farmers who were up in the northeast part of the state, where mostly dairy exists. And so we wanted to see if that virus that causes that disease in cattle could be transmitted to people. So of course, we wanted to see what it can do in non-human primates. And we did find that we could not necessarily produce leukemia, but we did find one of our primates that developed, as you can see right here, this thick lip, this thickened nose and eyebrows. This disease, this chimp had Hansen's disease or leprosy, and something that was never diagnosed in any other species besides people at that time. So what our speculation here was that the bovine leukemia virus may not have caused leukemia per se, but it damaged the immune system to the extent that it allowed this subclinical disease in this animal to become clinical. So, still we have the question, and that is bovine lymphosarcoma a zoonotic disease? So the question still hangs out there, and it's not one that has been disproven one way or the other. But anyway, some of the early history. And then I mentioned Keith Long up here, who did a tremendous amount of research as one of the 5 centers of human effects of pesticides at that time. So that really has threads of links to the agricultural health study, which Iowa is a part of a very large study that has studied the health effects of pesticides over the past 23 years, I think now, both in Iowa and combination of population in North Carolina as well. So lots of roots, lots of threads that find its way in what we do today. New facilities allow new research. The facility out at Oakdale, was a facility big enough that you could drive combines in, and we had a complete mechanical workshop. And so that allowed such things as to develop a video of people operating combines, so we could study how they interact with the controls on the combine inside the cab, so we could determine the best design of those instruments to make sure that they operated that in a safe manner. Pete Knapp was the engineer of the heading, that type of study. He also helped to redesign the power takeoff cover. There's a power takeoff shaft that rotates out of the back of a tractor to give power to a whole number of different instruments, different devices that are attached in the back of that. And people were getting wound up in that and getting an arm taken off or dying. And he designed a PTO shaft cover that helped to really eliminate that problem. He also worked on designing this slow-moving vehicle sign, which now is in most states is a law that tractors and other equipment on the road that is not moving faster than 20 miles an hour, or actually, I think it's faster than or below 40 miles an hour, by law has to have this slow-moving vehicle sign on it. And then Clyde Berry was also interested in tractor rollovers because then, as it is now, was one of the primary causes of death on farms. So I wanted to also then move now from sort of some of the threads of research and how they really find their way now in what we're doing today and between 73 and 83. So one of the challenges that I was given as a young professor was to develop an educational program in agricultural medicine. Well, we didn't really do any teaching in those early days, and it was my assignment to make that change. And so I developed this thing called Rural Health and Agricultural Medicine Training Program, which really was sort of almost a mini residency program for medical students, graduate students, nursing students, and all of those that were interested in practicing in rural areas. And it was worked in combination with a textbook that Connie Mutel and I wrote that would fit into that program, providing resources where there was no resources ahead. Well, I would have to say that program was the early stages of what we have today that has led to the agricultural medicine training program that we have now and headed up by Diane Roman that provides either a certificate program, a master's program, or a PhD program. And so that's, again, some of the roots as to where that is and how it has led to where we are today. So again, back to review just a little bit of department heads from 1955 to 99. And so I've talked to you about Dr. Top. This is a poor picture of him. I have just had one better that I showed you at their site when they had one of their committee's meetings. But I chose this because I don't know if anybody that's on there. Some of our perhaps mature faculty might remember who that person is. But that's Paul Leverton, and he was one of the early biostatisticians and really was the person who was I would say the star, if you will, that really helped to develop the biostatistics department as it evolved in the College of Medicine, in preventive medicine, environmental health, and now, of course, in the College of Public Health. And I mentioned already that he went on to become the department chair for epidemiology and biostatistics at the University of Florida, South Florida. And then Keith Long, I mentioned him. He was the department head, 70 to 72. Peter Isaacson, 72 to 84, and was really the person who was in charge of really kind of making the more mature department that really transitioned then later on into the College of Public Health. Bob Wallace took over as department head. Bob Wallace did come with Peter Isaacson from Buffalo, New York, where they were at SUNY at Buffalo, New York. So Bob came with Peter at that time and then became department head 85 to 93, and then finally merchant between 94 and 99. So now I wanted to talk to you a little bit about perhaps one of the most important events that has happened in this whole field of agricultural safety and health, at least from the standpoint of the medical and public health input. So in 1986, there was really a renewed effort for funding in agricultural occupational health. And Tom Knudsen, who was a reporter, journalist for the Des Moines Register, put together in a series of 6 articles that was published in the Des Moines Register called A Harvest of Harm, the farm health crisis. That really was excellently done. He worked with us here at the university with myself, Jim Merchant, and other faculty, and helped him guide through that hard series of articles. It received the Pulitzer Prize, and it really created a lot of awareness to the public of the issues of health and safety out into the general public. So that really kind of started things. And then, as I mentioned, this is a book that, one of the first books that we wrote, that was to be used to educate physicians or medical students and other healthcare people in our medical training or agricultural medicine training program. It so happened that Eugene Cole, who was the sort of foundation leader at Pioneer Hybrid International Foundation, got a hold of this book and read it and said that, boy, we need to do something about rural health care in this state. And so she met with us and wanted to put on a conference and so on. And I said, well, if you put on a conference, we'll do a proceedings, it'll go on the shelf and probably nothing will get done. So let's create something that will have life thereafter. And so we developed, Kendall Thu, by the way, was associate director for the early days of Iowa Center for Ag Safety and Health, was really helpful in putting together this strategic plan. And it was really 11-step policy development process. And it was successful. And it was well thought out. And there was really 11 steps that we went through. The idea was to create a public awareness, first of all. And we developed the National Coalition of Ag Safety and Health, which pulled together all of the people who had any kind of an interest in this whole field, both the safety side, extension, and so on and so forth, to get behind this whole movement. And then gather farm input. We established what's called the Farm Family Survey of what do farmers think of their issues out there? What are their problems? What do they think needs to be done? And then we had an invited scientific conference of 100 people to really get anybody that had any kind of research or data to get it out on the table to discuss it. And then we wanted to train other scientists in ag occupational health, to really train them up about what the issues were, because again, not a whole lot of research was available at that time. Then all of this material was published in one issue of the American Journal of Industrial Medicine, number 10, or volume 10, number 3. And then there was a policy making conference. So we invited policy makers from all over the state to really sit down with us and go over all of the results from these things and preliminary things, and to pull them into what they thought would needed to be done. And that resulted in publication into a policy document called the Ag at Risk, which I'll show you a little bit later. That led to, at the federal level, a joint House and Senate briefing, which led to new regulations. And then there was an advocacy effort on the NCASH, that is the National Coalition, to reach out to all of the federal agencies and state agencies. And then that resulted in the first Surgeon General conference in 50 years to kind of tap off this whole 11-step policy development process. And this is the policy document that came out of it, called Agriculture at Risk, a Report to the Nation, 1988. And this is what we took to the joint House and Senate briefing committee. in Washington, D.C. And so we presented that data along with a number of other people that were members of our national coalition. As you can see, James Merchant's name there, but he couldn't see him in the background, so I stuck his picture in right there. It was a part of that. And this led then to establishing a national initiative in agricultural safety law under Public Health 101-517. And that typically, besides just the law to say this is something we need to take care of, also allocated, excuse me, new monies, $24 million a year to help this situation. So the Surgeon General's conference then that followed on, excuse me just a minute. Dr. Antonia Novello was the Surgeon General from 90 to 93, and she really was the person who led that conference from, which was held in Des Moines, Iowa. And excuse me just a minute. Okay, I think I can go on now. But this was a big deal. This was a big deal. 11 new centers in agricultural health and safety came out of that through NIOSH. And you can see the location of where those centers are. And before this process, there were no other centers. It also helped to establish other centers in Vermont and North Carolina. And of course, and it really helped to facilitate the founding of Iowa Center for Agricultural Safety and Health, which is a state-run center, which was required legislation at the state level. David Osterberg was in the legislature at that time, who was also emeritus of our College of Public Health, helped to put that thing together and pull the legislation through. Well, the Institute of Agricultural Medicine really helped us and to help other institutions evolve. I think we were really helpful in allowing all of, the NIOSH program so that these 11 centers were available, but also a number of other things as well. Marilyn Adams started an organization called Farm Safety for Just Kids. And she's a farm wife who lost her son to a farm accident. And we helped her develop a national and almost international program for children's safety, mental health and behavioral health. We know that that's an issue within agriculture as well as other occupations. And Michael Roseman, who was one of our associate directors of Iowa Center for Ag Health and Safety, started a program in mental health and sowing the seeds of health. He is a farmer as well as a clinical psychologist and still is working in that area today. And then there's Jairus Peterson, a farm wife down in southern Iowa, who also lost her son, as Marilyn did, and started an organization to help pull together people who have had a farm-related injury or death in the spouse or children or one of their child, to help them grieve through that process and get back to a normal life as number as possible. But we also started an organization called AgriSafe, which had 22 clinics around the state, occupational health and safety clinics for farmers, that really went on and spun off as a national nonprofit organization run by Natalie Roy. And they work all over the country now in providing education and information in this whole area. And Farm Safety Day Camps is another program that was really started here, and now that's taken over as a national program by Progressive Farmer Foundation. And then the Institute in North Carolina, Institute of Agro-Medicine, helped that get going. And then in Australia, the National Farmers Health Center in Australia was formed by Sue Brumby, was a leader. She attended our training program here and came here for a sabbatical and went back and developed that center in Australia. So there really was a national and international reach, and another one of those reaches is trying to expand the occupational health core course, basic core training, which was really started out here in Iowa, now led by Diane Roseman, to 9 different states, as well as Sweden, Turkey, and Australia all over. So again, had quite a bit of national reach, if you will. So let me just kind of finish up here now and indicate that the University of Iowa's centers in occupational health following agricultural risk. All of these centers were developed, not necessarily directly related. Some of them as a direct result of agricultural risk, others because there was just more of a national awareness and interest in the whole thing, but some of them may not necessarily be related to agriculture. But the ones that I have highlighted in yellow have at least they're all directly focused on agriculture, or they have some aspect of their activity in agriculture. So Iowa Center for Ag Safety and Health is all ag health and safety, as is Great Plains Center Environmental Health Sciences Research Center, and which has had research areas, particularly in the area of respiratory diseases. Peter Thorne has directed that, and then the Heartland Occupational Health Center also really helps to fund the training program in agricultural health and safety. And of course, that's still an ongoing center. And then the Injury Prevention Center, and Corey Picasa directs that center. And some of the activities in agriculture has been crash prevention between farm vehicles and cars, as well as other activities. And then finally, the Healthier Workforce Center. Diane Roman heads that center up, and I know that she has interest in some activities in agricultural health and safety there. So you can see it has had a large impact and still does have a large impact. And so if I were to summarize everything here now, the IAM was a unique organization, really the first of its kind in the world. And it was the first entree, if you will, of medicine and public health into the field of ag safety and health. It was a building block. And when added to the old Department of Occupational Environmental Health, made it eligible, old Department of Preventive Medicine and Environmental Health, made it eligible to form a new college of public health. So it had some assistance there. And then the Institute of Ag Medicine was a modeler and helper to numerous organizations nationally and nationally as well as internationally, as I mentioned. So that's my story, and I'm sticking to it. And again, this is an effort that started way back in 1999, and collecting data from various sources, all the way from notes that were taken at faculty meeting to memoirs to wherever, to put all this thing together. And it is, again, I guess gave you some snapshots out of this book, this press book that's helped facilitated by the University of Iowa Library here. So I commend that to you to look into that for your interest. So we'll give you a little bit deeper look into that whole effort. And so again, I want to thank you for your attention, and I hope that this piques your interest a little bit about where you came from, why you're here now, and how you got here, and really on into the future to think about who it was before you that allowed you to get here, and also to learn from them so that you build on what they did and not reinvent the wheel that they created. So that's it. And if you have time or interest for any questions, I'll try to hang on for that.
Okay, Kelley, thank you so much for your seminar today, but thank you more importantly for preserving this rich history of the college that would have otherwise possibly gone lost if you hadn't taken the time, you and others, to preserve this important information. We're at the end of the seminar time, but for those folks that have time and would like to stay on and ask Kelley questions, please do just go down to your reaction and hit the hands up for if you want to ask questions. But otherwise, don't feel like you need to stay. But again, Kelley, thank you so much for the seminar.
All right, thank you. If you have other questions that come up now or later, Bill knows how to get a hold of me.
Okay, well, we see one now. I think Lindy has a question.
Yeah, so I know you touched on it briefly, talking about the mental health and agricultural medicine. Would you say that compared to maybe today, was mental health as big of an issue when you guys were starting out versus now, or is it exacerbated by climate change, do you think?
Well, what I can say is that we were interested in the mental health of farmers way back when. As I mentioned, Mike Roseman, who was our early associate director of Iowa Center for Ag Safety and Health, was a clinical psychologist, and we did a lot of programming in that area to help farmers overcome their stress issues. And comparing it to today, boy, it's really hard to know. Farming has always been stressful. It's you can't depend on what the weather is going to do, and what you get at the end of the year may depend on whether you're going to be in business, whether you're going to have to sell the farm the next year or not. There are obviously injury health problems out there. It's really difficult to say if there's more issues today than there was back in those earlier days.
Yeah, I was just wondering with maybe how it might be talked about a little bit more now, just because of climate change kind of worsening those problems of variability of weather and all of that.
Yeah.
But thank you.
Yeah. Well, yeah, I'm sure it's more of a thing that people talk about. Is probably a little bit less, at least in the younger farmers, it's a little bit less of a stigma to be able to, really come and say that, hey, I'm stressed, whereas in the past it was sort of man up and put up with it and so on. And climate, go ahead.
I see Jerry has a question as well.
All right.
Go ahead, Jerry.
Okay. Yeah, can you hear me now?
Yep.
Okay. You mentioned one of your compatriots made some recommendations on combines and how to make them safer.
Yeah.
Did that translate in? I mean, did you meet with folks at John Deere or somewhere, and did that actually translate into actual machinery?
Yeah. Well, first of all, for sure, that new power takeoff guide did. Now, in terms of the combine, what we were studying, or Pete was studying at that time, was studying how the operator interacts with all of the different instruments inside, the steering and the controls for the header and so on and so forth. And so that resulted in how they design the cockpit of those combines so that they can operate it in a much more efficient and practical manner, I would say. So yeah, so those are some things that really were translated into real,
But you actually met with designers, or someone did meet with designers at some of the machinery companies?
Yep, this was International Harvester, that from the combine.
Okay.
Yeah.
Okay,
yeah.
Great.
Yeah, and also one of the things that Pete was very interested in, and that's getting rollover protective structures on tractors, or rollover protective roll bars, if you will. And it was what happened out of all of the research that was done in the epidemiology was that in 1980, I think it was, that might not be quite the right year, that there was a industry standard that every tractor that's put on that's sold must have a rollover protective structure on it, because up to that time, it was not, you didn't come from the factory with a rollover protective structure on it. You had to you had to buy that as an option. And yet we know that that was one of the main problems where farmers were killed from the tractor rolling over on top of them. So that effort really helped, to get on tractors since 1980 with roller protective structures on them.